On this edition of Native Report, we visit the offices of Damber, Scott, Gerzina, and Wagner, an architectural firm known for its work across Indian country. We then interview children's book author Cheryl Minnema, and then we visit the Indian Health Board of Minneapolis. We also learn what we can do to lead healthier lives and hear from our elders on this edition of Native Report.
Production of Native Report is made possible by grants from the Blandin Foundation, the Duluth Superior Area Community Foundation, and the Shakopee-Mdewakanton Sioux Community.
Thanks for tuning in and welcome to Native Report. I'm Michael Lagarde. DSGW architects based in Duluth, Minnesota have done 175 projects with more than 30 Native nations across Indian country. The firm has built tribal government centers, schools and colleges, and healthcare facilities. Join us now as we meet Mike Laverdure, a member of the Turtle Mountain Band of Chippewa in North Dakota, one of 9 principal partners at DSGW, and director of First American Design Studio. Of the many moments in Mike Laverdure's youth that led him to a career in architecture, the one that may have had the biggest impact may be the time he paid an unannounced visit to North Dakota State University.
My dad was a journeyman engineer. He was a World War II vet. He also served in Korean conflict. And he taught me algebra when I was a 5th grader and 6th grader. He wanted me to be an engineer. And I liked math, but I liked art. And so I did a book report, I don't know when, in my high school years on Leonardo da Vinci. And that's what said, you know what, you can be an architect. And on a whim, I went down to NDSU when I was a junior in high school. And it was kind of funny. I walked into the president's office and said, can I meet with him? I didn't know you couldn't do that. And I met with him, and he gave me a tour of the architecture school. And he said, I'll give you a scholarship if you come to school here. And I said, fine. And I went to school at NDSU 2 years later. And I've just never looked back.
Today, Mike is principal partner at Damber, Scott, Gerzina, and Wagner. He is also president and owner of First American Design Studio.
There is probably only a couple dozen Native architects. There's probably only a couple dozen or more engineers. I regularly speak at different conferences, and the speech that I give all the time is why our communities need more Native architects and engineers. It's one of the things that I have a real passion for. I think if I had a legacy, any legacy in this profession, is sometime in the future, I had a kid come up to me and said I became an architect because I heard your speech. I would think my job would be done. I enjoy the architecture, but I think that architects are kind of amplitude magnifiers, because if we do good architecture, it impacts so many tribal citizens' lives. So it's just kind of a passion of mine.
That passion was recognized by Randy Wagner, principal partner at DSGW, an architectural firm known for its work across Indian country.
I became a partner in 1991 and have, for the most part, been working in Indian country, Native communities since then. From there, we evolved. We are working basically across the northern tier of the country, all the way out in Washington, state of Washington, for the Colville Reservation. We're working out in as east as Michigan, and we have projects as far south as New Mexico. Our focus down in the Twin Cities, which is where Mike Laverdure and I occupy space in our office down there, for the most part is tribal work. You know, it's a small world in Indian country. once one tribe hears about a project in another reservation, they become interested simply because of the success of that project. The biggest thing as of late has been healthcare. And one thing that has helped our cause is we have 2 interior studios within our business. One is we have a healthcare studio, and the other is we have a First Nations studio as well.
And one of the things that my mom always told me, and one of our values in our firm, is we listen. She told me you have 2 ears and 1 mouth for a reason. And what we need to do is listen to participate, and this 2-way listening and learning, because the only way you're going to learn how to work with a tribe is to listen to how they teach. And the way they teach is through storytelling. So we always do this active listening session called Guiding Principles, and we learn about functional and financial and sustainability. But the cultural one is where we really draw out where we learn how tribes want to represent themselves. You learn that Bay Mills, they're called the people of the pike. Or you learn that in Fond du Lac that the Makwa, the Bear Clan symbol, is something you don't put on the carpet. You don't walk over that. Or you learn, just because I'm Anishinaabe doesn't mean I know what it means to be Anishinaabe from Fond du Lac. And so we never take anything for granted.
The firm, through Mike's guidance, has incorporated the teachings of the 7 grandfathers into their philosophy called the 7 Principles of Native Engagement. And it shows with the design elements put into their projects with Native nations.
There's one that goes way back, one project that goes way back, and that's the Fond du Lac Ojibwe School. It was one of the first projects where we actually were asked to incorporate culture in the design. The school superintendent at that time had this idea that maybe we ought to watch a play that a number of second and third graders were putting on that same day that we had the meeting. And for the most part, it was the play about the evolution and establishment of Turtle Island. It was rather enlightening to us and all of us on the cultural committee, what was going to be the cultural integration symbolism that was going to be part of that building, and that was the turtle.
Each building that we go through and do these kind of processes and engagement principles, every one of them has a story like this. I mean, we could probably just go on and talk about each one of the buildings, the Red Lake Tribal College, how those eagles got designed and what they meant, and Sky Dancer Casino, why we designed it the way we did. And there's just so many stories that we could tell, and that's the beauty of what we do. Minneapolis India Young is probably one of my favorites. Another one that we did about 10 years ago was a casino from my home reservation, and I like that one too. The design of the casino is called Sky Dancer, and in Ojibwe it's Wawate, and Wawate means Northern Lights. Their logo is an actual person, a traditional grass dancer dancing. So the building itself has like a roach on top of the hotel that's lit up like the Northern Lights. The building itself has an exterior skin that moves like the Northern Lights. The canopy is like an eagle fan from the bustle. And then there's like a belt buckle on the building. So we used all these kind of literal translations to turn into design elements. It's all about a matter of respect for each other. The tribes respect us, and we of course respect the tribes that we work with.
At the time of this recording, it's March 17th, 2020. In the United States, we're at the beginning of the COVID-19 viral pandemic. Globally, there are over 181,000 people positive for the virus, and 7,100 have died. This is still early on, and no one knows where this will go. So far, 4,482 people have tested positive in the United States, and at least 86 people have died. There are 54 cases in Minnesota with no deaths yet. 3 days ago, there were 21 cases in Minnesota. There is a shortage of tests. Our ancestors weathered hard times. They took care of each other, and they shared their knowledge, and they shared the gifts they had. Hard times brought out the best in them. We need to show our best and be worthy of our lineage. Our ancestors suffered hoping things would be better for us, and no one chooses to be in a global pandemic. We all have different roles in this. There are some who have no choice and will be exposed to the virus simply by doing their jobs. They will be under enormous stress and will appreciate any kind words or encouragement. For most, staying home and not exposing anyone or being exposed is the best thing to do. This will slow the spread of the virus and keep the healthcare system from becoming overwhelmed. Be the ones future generations look back on with gratitude and respect. Our children will do as we do. This is our opportunity to teach them our 7 grandfather teachings: humility, love, respect, courage, honesty, wisdom, and truth. The recommendations will evolve as the virus spreads. Follow the recommendations from the Centers for Disease Control and check facts before you believe or share misinformation. Be good to each other. Teach our children and treasure our elders. Be generous to those less fortunate. We truly are all in this together. Gigo Wabamin, Agamish Gode. I'll see you on the other side of the fire.
The memories Cheryl Minnema holds of her grandmother and brother are the inspiration for 2 picture books that may be for children, but the books impart lessons about patience, kindness, and respect. Cheryl also utilized Native American artists to illustrate her stories. We caught up with Cheryl while she was at a book signing event to find out more about the author and the inspiration behind her stories.
It's been a dream to be an author.
Cheryl Minnema realized that dream with the publication of her first children's book, Hungry Johnny, and today she is on hand to sign editions of her latest children's book, Johnny's Pheasant.
The process of sharing my stories is exciting and it's fun, and I'm glad when children can identify with the story and to have a little fun with it. I like to add humor to the story. So not only is it laced with a little bit of intertwined with traditional values, it also has a lot of humor in it as well. So it's fun to see the reaction of the children and hearing this story. I've always enjoyed listening to stories. There's so many stories within our culture that have been passed on orally, and I was raised by my mother and my grandmother, my sisters and my aunties. We lived a very traditional life. I feel fortunate that I had the upbringing that I did, to have spent so much time with my mom and my grandma, and all the experiences that we've had, and a lot of those people have passed on, and so the connection, how I feel, is like keeping their spirit alive.
Cheryl's inspirations for her 2 published works are her family, in this case, her grandmother and her brother. She's following the writer's mantra of write about what you know, while adding a bit of whimsy and fun to her stories to appeal to a younger audience.
Johnny's Pheasant is my 2nd published book. The first book is Hungry Johnny, and these are based off of memories of my little brother Johnny and Grandma. The memory actually took place with an owl, and so the original story, I wasn't there, I was away in college at the time, but my mom and John and Grandma talked about picking up the owl from the roadside, and they thought it was had been hit by a car or something, and my mom was going to use it for crafts. She was collecting owl feathers, she was going to make a bustle, and it really did. It must have only been knocked out, and it came to, and it flew around the living room, landed on Grandma's head, and it was quite the ordeal. The process of writing the story and sharing it, there's different beliefs within, even just within Ojibwe, a lot of different opinions on the owl itself, and I wanted to be respectful to people who were raised to view owls as a bad omen. And so even though that I wasn't raised with that particular belief, I wanted to be respectful and yet still share the story and the memory and the humor in it. So I changed it to a pheasant. I wasn't quite sure about the hooting, because the owls, you think of owls hoot hoot, but I decided to keep it in there, and I thought maybe it would be funny, or somebody could maybe think a little bit more about it and think maybe the pheasant was raised by owls or something, and then I didn't know what the illustrations would bring to the story, so I kind of left it open, and it worked out very well.
The illustrator for Johnny's Pheasant is Native artist Julie Flett.
After the story was done, and sitting down with the editor at the University of Minnesota Press, he was starting to envision what the story would look like with different illustrators. And when I saw Julie Flett's work, I knew right away that's the one I wanted. Her artwork is beautiful, and it's powerful, and it's perfect for Johnny's Pheasant.
Cheryl's entry into the crowded field of children's literature is due to a lack of stories by Native authors for a Native audience, especially Native children.
I have memories of growing up and how it felt to go into the library at school and not have very many books where we were in as Native Americans, and especially children, to see ourselves in literature in a contemporary setting and to be properly represented. And so that's been a passion to contribute to children's literature as an Ojibwe, to give the opportunity for children today to see themselves in literature. The more you read, the better you become at the craft of writing, to explore different authors, different genres, and keep reading. The more you read, the more you learn. And then even just with schooling, going to school and learning the craft of writing is helpful. You can be born with certain talents, but going to school helps sharpen up those skills. I'm quite the introvert. I like staying home and listening to music and doing beadwork and writing my poetry. So the attention is a little bit overwhelming, but I feel grateful.
Now, Janice, you're a first language speaker yourself, then?
I am not a first language speaker. I am. I learned some words and conversations from my grandmother and my parents, but I think for 5 years we lived in Leech Lake, and that's all I had around me was Native people. So I remember sights and sounds and everything. I don't remember if I spoke Ojibwe then. I know when we came to the city, I had to go to school in Duluth, and it was culture shock for me, very much so. My classmates looked strange to me. I thought they were dolls. I thought they were something like, in adult terms, like robots, because of this, "Good morning, Miss Smith," and they all said it a certain way. And I just kind of looked at them, and so I started doing that same thing. That's what they did, so that's what I did. But always, every time I wasn't in school, I was with my grandma.
The Indian Health Board of Minneapolis is a community health care clinic providing access to quality health care and wellness services in the heart of the Phillips neighborhood that has a large Native population. The clinic opened its doors in 1971 as the first urban Indian health center, and the original founders were driven to establish the IHB so that Native Americans in the Twin Cities would have a place where they feel welcomed. Do not let the moderate number of clinic staff or the number of services and programming deceive you, but the Indian Health Board of Minneapolis has a history going back decades of providing quality care to clients in one of the nation's larger Native American communities.
We're actually one of 10, I'll repeat that again, one of 10 longest continually accredited programs in the United States. We continue to make that investment locally as far as really high quality care services. And so we're very proud of really from our board perspective to our frontline staff. We continue to be very proud of really the excellent services we provide here at IHB. You know, we still see a lot of the health inequities, or you know what I guess the common term these days is health disparities. I don't necessarily like that term, but things in diabetes, of course, is a common thing that we run into, and we continue to find ways to provide really high quality services for within our medical department and our dental departments, as well as our behavioral health departments. Nationally, the census data tells us that about 70% of Native people live in urban health centers. And unfortunately, the in-house service budget line item has diminished from 1% to even less than 1% of the overall in-house service budget. So trying to find ways to provide programming and services continues to be a challenge, but we really find unique ways of making sure our services are provided and people have access to them.
The IHB can trace its beginnings back to the 1960s and 70s, and having longevity within the Twin Cities metro area can have its advantages.
I know that it used to be that back in the day, back in the late 60s, early 70s, where we used to have a physician come in from White Earth that would see people here in the Minneapolis area, just locally. They would probably see people in their homes or a storefront, or and just trying to find ways of getting and providing healthcare services here. That physician subsequently became the IHS director back in the day. Dr. Emery Johnson is his name. That really made really the formation of IHB and the urban Indian health line item basically is really where this was it's foundational rather. We're one of 9 clinics nationally that are full service, so they have dental, behavioral health, and full medical clinics, and provide those services to our local community. So we have a very unique situation here where we have a very concentrated population of Native people within the Phillips neighborhood. It was really important as far as the foundational piece for the Indian Health Board of being where Native people have been concentrated at. So we're closing in on our 50th anniversary right now. And so we've been a long-time partner with the state. We've been also a long-time partner with the city of Minneapolis and, of course, the county.
The clinic has 70 people on staff throughout the various departments, and well over 12,000 clients are seen on an annual basis. The clinic has future plans to expand their footprint within the community.
Numbers are important from an administration and from the federal government's perspective. We would want to see as many people as possible. That would make make really effective and efficient use of federal tax dollars that are meant for those services. So we want to make sure we see as many people and for their healthcare needs. I continue to see patients. It's something that is really important to me personally, that I have a connection to the people I serve and understand really the needs or the conditions that are affecting our community. So we've purchased a couple of pieces of property locally on Franklin Avenue, also known as the part of the Native Corridor on Franklin Avenue. We're looking to greatly expand our behavioral health services. And within about 5 years. We're looking at the medical as well as the dental departments to have a larger footprint, and also being also on the main native corridor. So being on a bus line, a local transit line, and as well as foot traffic are very important to us to make sure people know where we're at, as well as to have easy transportation access to our services. We continue to want to be relevant, and we continue to want to invest locally, and we want to make sure that the Native community is aware of us. We sometimes, currently our building is in a very residential area, and we want to make sure people have access to the services. And of course, we want to make sure that we address really all the health issues that we're facing now, and all the potential health issues that we could face in the relative near future.
For more information about Native Report or the stories we've covered, look for us on the web at nativereport.org, on Facebook, and on YouTube. Thank you for spending this time with your friends and neighbors from across Indian country. I'm Michael Lagarde. We'll see you next time on Native Report.
Rita Aspinwall is an enrolled member of the Fond du Lac Band of Lake Superior, Chippewa, and is an ICWA social worker with Fond du Lac Social Services. Ernie Stevens is a member of the Oneida Nation of Wisconsin and is a film and television producer.